My name's Dr. Angela Kwong. I'm a general practitioner practicing in Sydney. It sounds a bit corny, but I've always wanted to help people, and my personality has always been one of a problem solver as well. That's the reason why I chose medicine, because I like to solve problems, and that's the reason why I like general practice. So I did the new medical program at the University of New South Wales, and even from day one, we started seeing patients. So it wasn't all textbook based or theory based, we actually learned from the patients. Enlighten Me is a medically supervised weight loss program for Australians who have tried all the usual methods, and it encompasses 16 weeks where you have 6 medical consultations with the general practitioner, where we adjust the medication and your nutrition. We have weekly group coaching for support and accountability, a private group for peer support, and a bunch of exercise videos for you to be able to do at your own pace from the comfort of your own home. I developed Enlighten Me because I felt that there was a new way that we could support patients. I felt the way that we were practicing medicine, which was ad hoc and every 3 to 6 months, was not enough when it came to weight loss, and there was so much opportunity for a doctor to provide non-pharmacological support. So what happens in some of the other programs is, yes, you see a doctor, and yes, you're issued with a weight loss medication to kickstart the process, and you're given an app which has a bunch of exercises or a bunch of recipes or some mindset coaching, but it's the same information that's for everyone. It's not individualized, and it means that it's up to the patient to implement it on their own. So that's where Enlighten Me differs. It's someone who is assessing you as an individual, looking at your circumstances, and giving you recommendations on what they think would be the best for you. I'm someone who loves to empower patients with patient education, and so what I've done is created these 12 learning modules which patients do at particular time points before they come in for the consultation. So this means that before the consultation, the patients are able to consider the medication that they'd like, the pros and cons, the side effects and the costs, and we're able to come to that decision together. When people lose weight, it's not just about the centimeters off the waist or the kilos that they lose off the scales, but often what's important to them is regaining their energy, being able to chase their kids around the park, and having the confidence to go for that promotion in the workplace. In terms of outcomes, everyone's a little bit different. So some patients are able to lose more weight, some patients are able to lose less, and it really depends on their individual makeup, how compliant they are with the medication, the diet and the exercise. Everyone's a little bit different, but then again, everyone's goals are a bit different as well. I've been having these weekly coaching sessions with patients, and even though I just had 2 coaching sessions with them, all of the participants turned up and said that they've been snacking less, they've been having less cravings for chocolate, and I laughed and said, we haven't even started your medical consults, we haven't even started the program or started you taking any medications yet. And what they said to me was that they're in a different mind space now. So knowing that they've got that support, knowing that they're checking in every week, they're really motivated and enthusiastic, and they're able to stay on track. And I think that's an amazing thing. What motivates me is genuinely being able to help people. I also find the work really fun and engaging. I like seeing families grow up. I like being able to look after the mum, dad, the daughter, and the grandpa. I'm someone who really enjoys patient education, and being able to organize all of this knowledge into small modules, bite-sized learning for patients has been a real joy. And on top of that, what I found is a lot of doctors are looking for support, and a lot of doctors are looking for help with starting the conversation with patients on how to lose weight, and how I approach medically supervised weight loss, which is not just issuing the patient a script and hoping for the best when it comes to their lifestyle factors, but providing that support and education along the side. Of course, it feels rewarding when a patient directly says to you, thank you so much for helping me, or you've turned my life around, or you're the only person who my teenager is able to open up to when it comes to their mental health. So that's incredibly rewarding. So the next steps would be to book into one of the weight loss masterclasses to learn a little bit more about the fundamentals of weight loss and what the Enlighten Me program involves, and then book in a weight loss breakthrough call, which is a free 45-minute phone call where we'll assess your medical situation and let you know the next steps going forward.